A provider asks you to obtain a midstream urine specimen, but the patient is confused. As a CCMA, what is your best action? A. Collect a random specimen instead. B. Ask a family member to assist with instructions. C. Clearly demonstrate the cleansing and collection steps. D. Cancel the test until the provider reorders. Answer: C. Confused patients may not understand verbal instructions alone. Demonstrating the process ensures the specimen is collected properly without contamination. A CCMA is preparing to perform an EKG on a patient with Parkinson's tremors. What should you do to minimize artifacts? A. Perform the EKG standing up. B. Place electrodes on the thighs and shoulders. C. Ask the patient to hold their breath. D. Document tremor-related artifact and proceed. Answer: D. Tremors cannot be completely eliminated. Documenting the cause of artifact provides accurate context for provider interpretation. A child presents with multiple bruises in unusual patterns. The parent insists it was just from playing. What is your legal obligation? A. Report suspicion of abuse immediately. B. Wait for physician confirmation. C. Reassure the parent you will not report. D. Document only what the parent says. Answer: A. Mandatory reporting laws require healthcare workers to report suspected abuse immediately, regardless of parental explanation. A patient is fasting for blood work but becomes lightheaded while waiting. What should you do first? A. Offer them water and notify the provider. B. Perform venipuncture quickly before symptoms worsen. C. Instruct them to continue fasting until the draw is over. D. Cancel the lab test and reschedule. Answer: A. Water does not break a fast, and hydration helps prevent syncope. The provider should be notified if symptoms persist. Which of the following would require placing a patient in airborne precautions? A. MRSA infection. B. Pulmonary tuberculosis. C. Difficile colitis. D. Influenza. Answer: B. Airborne precautions, including N95 respirators, are required for TB to prevent spread through tiny respiratory particles. While assisting in a minor surgical procedure, the sterile field is accidentally touched by your unloved arm. What must you do? A. Cover the contaminated area with a sterile drape. B. Continue without saying anything. C. Inform the provider and replace contaminated items. D. Disinfect the field with alcohol. Answer: C. Any break in sterility must be reported immediately and corrected to prevent infection risk. A patient with diabetes reports tingling and numbness in both feet during intake. What should you do? A. Document the symptom and notify the provider. B. Ignore since this is common in diabetes. C. Recommend over-the-counter pain medication. D. Schedule a foot exam without notifying the provider. Answer: A. Peripheral neuropathy is a significant complication of diabetes. Documenting and alerting the provider ensures timely care. Which of the following requires use of a winged infusion set, butterfly needle? A. Drawing blood from a muscular adult. B. Obtaining blood from small fragile veins. C. Collecting urine samples. D. Performing intramuscular injections. Answer: B. Butterfly needles are designed for small or fragile veins, common in pediatric, geriatric, or oncology patients. A CCMA notices a sharps container is filled above the line. What is the safest action? A. Push sharps down to make space. B. Remove some sharps and place in another container. C. Seal the container and replace with a new one. D. Continue using until completely full. Answer: C. Overfilled containers increase needle stick risk. OSHA requires replacement when filled to the designated line. Which action is appropriate if a patient refuses a procedure? A. Explain risks of refusal and document the refusal. B. Attempt to convince them multiple times. C. Proceed since the provider ordered it. D. Delay documentation until the end of shift. Answer: A. Patient autonomy must be respected. The CCMA must document refusal and inform the provider. A patient with a latex allergy requires a blood draw. What is the correct step? A. Use latex gloves but work quickly. B. Use non-latex supplies. C. Cancel the blood draw. D. Have the patient sign a waiver. Answer: B. Using non-latex gloves, tourniquet, and supplies prevents an allergic reaction. A CCMA suspects the EKG machine is not properly grounded after repeated artifacts. What is the safest action? A. Continue with the tracing. B. Unplug and tag the equipment for inspection. C. Wrap wires in tape. D. Perform EKG manually. Answer: B. Faulty equipment poses electrical hazards. It must be removed from service until inspected. Which action should be taken when handling a specimen for a cold agglutinin test? A. Keep it at body temperature until testing. B. Place it on ice immediately. C. Store at room temperature. D. Centrifuge immediately. Answer: A. Cold agglutinins must remain at 37 degrees Celsius, body temperature, until testing to preserve accuracy. A patient becomes unresponsive while sitting in the waiting room. What should the CCMA do first? A. Move the patient to a private room before helping. B. Search for their chart. C. Wait for family to arrive. D. Call emergency services and check responsiveness. Answer: D. Checking responsiveness and activating EMS are first priorities in a suspected emergency. While preparing a patient for Holter monitoring, what should you instruct? A. Avoid showering or bathing during monitoring. B. Remove electrodes when sleeping. C. Record only chest pain symptoms. D. Perform normal daily exercise only in the clinic. Answer: A. Showering or bathing can interfere with electrode adhesion and recording. A patient with anxiety begins hyperventilating during a blood draw. What is the most appropriate response? A. Stop procedure, instruct slow deep breaths, and resume once stable. B. Continue drawing blood quickly. C. Ignore symptoms. D. Administer oxygen immediately. Answer: A. Calming techniques and halting the procedure protect the patient's safety and comfort. A CCMA receives a lab result showing critical potassium levels. What is the immediate next step? A. Call the patient directly. B. Document only in the chart. C. Notify the provider immediately. D. Repeat the test without informing anyone. Answer: C. Critical lab values must be reported to the provider immediately for urgent management. When performing venipuncture, which action can cause hemolysis? A. Using a small gauge needle with high suction. B. Gently inverting tubes. C. Allowing the site to dry before puncture. D. Using the median cubital vein. Answer: A. Excessive suction or too small a needle damages red blood cells, leading to hemolysis. A CCMA must prepare a sterile field for a suture removal. Which item would contaminate the field? A. Placing sterile gauze with sterile forceps. B. Reaching across with unloved hands. C. Adding items with sterile technique. D. Keeping items within the sterile drape. Answer: B. Reaching across without sterile protection contaminates the field and requires repreparation. A patient refuses to sign an informed consent form but agrees verbally to a procedure. What should the CCMA do? A. Document verbal consent and notify the provider. B. Proceed without documentation. C. Sign on behalf of the patient. D. Cancel the procedure without telling the provider. Answer: A. Verbal consent is acceptable but must be documented clearly and communicated to the provider. If a tourniquet is left on longer than 1 minute, what error is most likely? A. Hemoconcentration. B. Low potassium result. C. Diluted plasma. D. Reduced clotting factors. Answer: A. Prolonged tourniquet application concentrates analytes, affecting test accuracy. A CCMA is preparing to assist with spirometry. Which patient action ensures accurate results? A. Perform short, shallow breaths. B. Exhale forcefully and completely. C. Hold breath during the test. D. Inhale quietly and stop. Answer: B. Spirometry requires a full, forceful exhalation to measure lung function accurately. A patient expresses suicidal thoughts during intake. What is your responsibility? A. Notify the provider immediately. B. Ignore and continue intake. C. Call the patient's family instead. D. Tell the patient to return next week. Answer: A. Suicidal ideation is a medical emergency that must be reported to the provider immediately for intervention. A provider instructs you to administer a 2 ml IM injection to a thin adult. Which site is safest? A. Deltoid. B. Ventrogluteal. C. Dorsogluteal. D. Forearm. Answer: B. The ventrogluteal site avoids major nerves and vessels, making it the safest IM injection site. When applying PPE for contact isolation, which order is correct? A. Gloves first, then gown. B. Gown first, then gloves. C. Mask, then gloves, then gown. D. Goggles, then gloves, then gown. Answer: B. Gown is applied before gloves to ensure the cuffs of the gown are covered, maintaining full protection. A CCMA is preparing a patient for a Holter monitor. Which instruction is most important? A. Keep the electrodes dry and avoid removing them. B. Avoid eating solid food for 24 hours. C. Take all medications only at night. D. Disconnect the monitor before sleeping. Answer: A. A Holter monitor requires continuous recording of cardiac activity. Electrodes must remain in place and dry for accurate results. When documenting a patient's chief complaint, what is the correct approach? A. Summarize it in medical terminology. B. Record it in the patient's own words. C. Paraphrase to make it shorter. D. Leave it blank if unrelated to visit. Answer: B. The chief complaint should always be recorded in the patient's exact words to maintain accuracy and clarity. A provider orders 250 milligrams of a drug. The stock is 125 milligrams per tablet. How many tablets should the CCMA administer? A. 1. B. 2. C. 3. D. 4. Answer: B. 250 mg divided by 125 mg per tablet equals 2 tablets needed to provide the prescribed dose. What is the first step in responding to a patient experiencing syncope during a blood draw? A. Call emergency services immediately. B. Apply pressure to the venipuncture site. C. Lower the patient's head and raise their legs. D. Give the patient water to drink. Answer: C. Syncope is fainting. Proper response is positioning to increase cerebral blood flow, usually by elevating legs and lowering head. A CCMA notices a discrepancy between a patient's medication list and the pharmacy label. What should the CCMA do? A. Correct the label immediately. B. Report it to the provider before administering. C. Ask the patient which they prefer. D. Continue with the pharmacy instructions. Answer: B. Medication discrepancies must always be clarified with the provider to ensure patient safety and prevent errors. During CPR training, the CCMA learns the correct chest compression rate for adults is: A. 60 to 80 compressions per minute. B. 90 to 100 compressions per minute. C. 100 to 120 compressions per minute. D. 130 to 150 compressions per minute. Answer: C. The AHA recommends 100 to 120 compressions per minute for effective adult CPR. A CCMA is scheduling a patient for a fasting blood glucose test. Which instruction is correct? A. Avoid eating or drinking anything except water for 8 to 12 hours. B. Continue normal diet but skip water. C. Fast only for 2 hours before the test. D. Take no medications until after the test. Answer: A. Fasting glucose testing requires 8 to 12 hours of fasting. Water is allowed. A urine specimen collected for drug testing must follow strict protocols to prevent: A. Hemolysis. B. Contamination. C. Chain of custody errors. D. Excessive foaming. Answer: C. Chain of custody ensures specimen integrity and prevents tampering or misidentification. Which blood draw site should be avoided in a patient with a mastectomy on the right side? A. Right arm. B. Left arm. C. Left hand. D. Dorsal hand vein. Answer: A. Venipuncture should be avoided on the side of mastectomy due to risk of lymphedema and infection. What is the correct angle of needle insertion for intradermal injection? A. 15 degrees. B. 30 degrees. C. 45 degrees. D. 90 degrees. Answer: A. Intradermal injections are given at a shallow 10 to 15 degree angle to place medication between skin layers. Which task is outside the CCMA's scope of practice? A. Obtaining vital signs. B. Administering oral medications as directed. C. Interpreting lab test results. D. Performing an EKG. Answer: C. CCMA can collect data but cannot interpret diagnostic results. Interpretation is the provider's responsibility. A patient reports difficulty swallowing tablets. What is the CCMA's best action? A. Crush the medication and mix with food without approval. B. Ask the provider if an alternative form is available. C. Instruct the patient to swallow quickly with little water. D. Cancel the medication order. Answer: B. The CCMA should communicate with the provider for alternative formulations, e.g., liquid or dissolvable. In which position should a patient be placed for rectal temperature measurement? A. Supine. B. Sims. C. Fowler's. D. Lithotomy. Answer: B. The SIMS position provides safe and proper access for rectal procedures, including temperature measurement. Which instrument is used to examine the interior of the ear canal and tympanic membrane? A. Ophthalmoscope. B. Otoscope. C. Laryngoscope. D. Endoscope. Answer, B. An otoscope allows visualization of the ear canal and eardrum during physical exams. When preparing a sterile field, the CCMA accidentally touches the inside of the sterile package with ungloved hands. What should be done? A. Continue since the outside is still sterile. B. Disinfect the touched area and use it. C. Discard and prepare a new sterile field. D. Use gloves and proceed without change. Answer, C. Any break in sterility invalidates the field, a new sterile field must be established. What is the first action if a patient suddenly develops chest pain in the exam room? A. Leave the room to get the provider. B. Apply an ice pack to the chest. C. Notify the provider and monitor vital signs. D. Give the patient food and water. Answer, C. Immediate monitoring and provider notification are essential for chest pain, as it could indicate a cardiac emergency. Which needle gauge is typically used for venipuncture in adults? A. 18 to 19 gauge. B. 20 to 22 gauge. C. 24 to 26 gauge. D. 14 to 16 gauge. Answer, B. Standard venipuncture uses 20 to 22 gauge needles. Smaller gauges may cause hemolysis, and larger gauges can cause trauma. A CCMA must dispose of a used needle after injection. What is the correct action? A. Recap the needle before disposal. B. Bend the needle to make it safe. C. Place it immediately in a sharps container. D. Place it in regular trash if capped. Answer, C. Needles must never be recapped or bent, they must go directly into an approved sharps container. A patient is scheduled for spirometry. What should the CCMA instruct before the test? A. Avoid using inhalers or bronchodilators unless instructed. B. Drink coffee or tea before arrival. C. Eat a heavy meal within 1 hour before testing. D. Perform vigorous exercise just before testing. Answer, A. Medications affecting lung function may need to be withheld to ensure accurate spirometry results. A CCMA is collecting a throat culture. Which step is correct? A. Swab the tongue and inner cheeks. B. Avoid touching the teeth, tongue, or cheeks. C. Collect saliva from the back of the throat. D. Use cotton gauze instead of a swab. Answer, B. The swab must contact only the tonsillar and pharyngeal areas. Contamination with saliva invalidates the sample. Which vaccine is typically administered subcutaneously? A. Influenza. B. Hepatitis B. C. Tetanus. D. MMR. Answer, D. MMR is administered subcutaneously, while influenza and tetanus are usually intramuscular. When measuring an infant's head circumference, the tape should be placed A. Across the ears only. B. Just above the eyebrows and ears, around the occipital prominence. C. At the base of the neck. D. Across the cheeks and chin. Answer, B. Correct measurement is above the eyebrows and ears, around the largest part of the skull. Which PPE is essential when handling body fluid specimens? A. Mask only. B. Gloves only. C. Gloves, gown, and protective eyewear. D. No PPE is required. Answer, C. Gloves, gown, and eye protection are required to prevent exposure to potentially infectious materials. A CCMA should verify a patient's identity before venipuncture by asking: A. What is your date of birth and full name? B. Are you Mr. Smith? C. Do you live at this address? D. Is this your insurance ID? Answer: A. The safest verification method is asking the patient to state their full name and DOB, not yes/no questions. Which of the following is a CLIA-waived test a CCMA may perform? A. Blood culture. B. Pap smear. C. Urine pregnancy test. D. Tissue biopsy. Answer: C. Urine pregnancy tests are CLIA-waived, and within CCMA scope, other tests require higher complexity certification.